folks are as folks are joining, would you please enter into the chat box your name, your organization, and one thing that, or one area that you believe this funding could certainly support the work that you are doing. So please enter to the chat box your name, your organization, and one particular area or way that these access and engagement dollars can help support your work. And as you also may have heard through the, sounded like the little robot that was chatting, but we are recording this meeting so that we can share it with those who were not able to join us today. Wonderful. Wonderful. So I'm seeing lots of information coming in the chat box. Again, to those of you who are just now joining, my name is Maria Gingrey, and I have the pleasure of serving as HealthierHere's Director of Equity and Community Partnerships. I utilize the gender pronouns she and her, and I am happy to be here with you today to facilitate this discussion. We are joined today by Tavish Donahue. Tavish, would you like to introduce yourself to the group?
It would be my pleasure. Hi, everyone. I'm Tavish Donahue. I use the pronouns she and her, and I'm Senior Practice Transformation Manager at HealthierHere. Great to have you all with us this morning.
Thanks so much, Tavish. Well, Tavish and I are going to go ahead and get started. We see, I think that we've got a critical mass here has joined us. We may have a couple of folks that join as we continue, but we will launch into the discussion information for you. Again, Tavish and I are here to sort of share with you a deeper dive into HealthierHere's Access and Engagement, RFA, and we're going to give you an overview of the request for applications, as well as provide you with an opportunity to ask any questions that you may have, engage any thought partnership that you may have around that as well. So as you see, I'm going to be sharing my screen. Oops, sorry. There we go. I'm going to be sharing my screen, and if I will be pausing for questions. However, if you have any questions that come to mind before a pause, please feel free to enter those questions into the chat box, and we'll bring them into space. Also, if you happen to be having any difficulty with your computer or technology or connection, please do send a direct message to Tavish, and Tavish will do what she can to help support you on that end as well. So the Access and Engagement Fund is essentially a new HealthierHere investment, and the dollars are from our Medicaid transformation dollars that were approved by HealthierHere's governing board as part of our holistic investment strategy. And we're really grounded in the belief that the coordinated, holistic, and linguistically relevant approach is needed to help support your ongoing work. And that's ongoing work around helping community members access the physical and behavioral healthcare system, as well as engage with that system. Our focus is around working with communities who are experiencing health disparities. And one of the questions that you may have is whether or not these dollars need to be focused solely on COVID recovery, relief, and response. And the answer to that question is no. We do recognize that many disparities have in fact been exacerbated during the pandemic. And so these dollars can be used to help part of the provision of COVID recovery services that you're providing to community members. However, you do not have to specifically focus in that area. What we're really looking to do is to provide financial resources for your organizations to hire or retain community-oriented staff positions. So when we talk about, again, those community-oriented staff positions, we're talking about those kinds of positions and those traditional, in certain job classifications, they're community health workers, so they're CHWs. In other organizations, they're peer support specialists. In other organizations, they're cultural navigators. In other organizations, they're community navigators, and in other organizations, they're recovery coaches. So what's important to know is we try to be as inclusive as possible around what the particular titles are, but we're not as tied to the particular title of the position. Rather, we're really looking at what the role of the position is. So we're looking to fund and provide financial resources for organizations that are hiring again or retaining those community-oriented staff positions that are really delivering the culturally appropriate community-based care, which includes conducting outreach, providing information, creating linkages to primary care, traditional medicine, behavioral health, and social supports that address the social determinants of health system. It also is inclusive of those community-based roles and positions who are helping community members to navigate various health systems, both physical and behavioral health, as well as social determinant of health systems. Our goal here, again, is to provide that coordinated, that holistic approach, recognizing that health looks different in different communities and to different community members. And we wanted to ensure that we were able to resource your organizations to help access and engage with the physical and behavioral healthcare system in ways that make sense for the community members that you are serving. Who is eligible for this particular funding? This particular funding is eligible to HealthierHere partners only, and specifically our practice partners. For community-based organizations, that means our Tier 1 and Tier 2 community practice partners. For our clinical partners who are on the line, just so that you know, our Tier 1 community practice partners are community-based organizations who tend to be a little bit larger in size and scope, and they provide the outreach and engagement services, as well as in many cases, providing additional linkages and screening for the physical and behavioral healthcare system. Our Tier 2 community practice partners are those organizations who, like the Tier 1 organizations, are grounded in community, and they also have do a lot of work as it relates to the outreach and the engagement work for community members experiencing the most severe and persistent health disparities in King County. Also, for the eligibility, our clinical practice partners that are behavioral health agencies are eligible to apply. Federally qualified health centers that are clinical practice partners are also eligible to apply. So we focus the eligibility for this investment on our practice partner because of our work with our practice partners and ensuring that we have those organizations in our practice partner pool who have the greatest reach and sort of that depth and breadth of reach into community to be able to reach the greatest number of community members and or to be able to reach those particular niche communities who are in fact experiencing health disparities but may be harder to reach and or may be lesser engaged with the healthcare system. In addition to having our practice partners being eligible, again, the Tier 1 and Tier 2 community practice partners, behavioral health agency clinical practice partners, and FQHC clinical practice partners, applicants must also have experience hiring and supervising community-oriented positions. And again, those are the positions that we listed that we're looking to support, which are those community-based community health workers, peer support specialists, community navigators, cultural navigators, and or recovery coaches. We have a total of $2.35 million to invest in this particular investment fund. As such, our applicants are eligible to receive up to $150,000 each. Now, what we're requesting that you do is certainly to develop the budget that works best for your organizational needs. We say that because we recognize that some organizations may not need a total of $150, or excuse me, $150. You need that, $150,000. So if your organization is proposing to do this work and it may only take you $50,000, then fine. Please feel free to go ahead and only apply for up to $50,000. That said, if it's going to take you the full $150,000 to be able to do the work, then we certainly are open to entertaining applications up to that amount. However, we will not be accepting applications that are over $150,000. And we also are reserving the right to negotiate a budget based on our review of your application. So, for example, we may find that you are proposing to do a certain body of work. While it is very important, it may not necessarily be as aligned with this particular funding investment. And so we may have some negotiations with you about revising your budget accordingly. The award amounts that we do provide will truly vary depending on the populations that you're serving, as well as that proposed scope of services. And that again is where the negotiation may occur with Healthier Here and your organization to find the appropriate amount to help achieve our desired goals. The award period for this work is approximately 17 months. So we are hoping to be able to make awards in July and then provide you the ability to do that work between July of this year and December 31st of 2022. You will not have to reapply for the funds in 2022. Rather, this will essentially be a 17-month investment. How might the funds be able to be used? There are a variety of ways that you can use the funds, and please know that you may have some other ways that you see would be of value to do your work in a culturally appropriate and respective and authentic way with your community members. But what you see listed are just some examples of ways that you can use the fund. Included within the RFA is another list of ways that the dollars are in fact excluded. So for example, capital campaigns and those sorts of things cannot be funded through these dollars because these dollars are in fact federal dollars that are passed through to us. So we do have to observe the federal requirements as well. So some of the ways that we thought that you could certainly be able to use the funds and examples would be staff capacity, of course, and that could be hiring new people or it could be retaining people that you may have hired during part of your COVID recovery, and you would like to keep them on staff to help serve individuals who are experiencing the greatest health disparities, but you may not have existing funding. So it can certainly be used to support staff that you have hired recently to do this kind of work. Equipment. So we also recognize that you may, if you're hiring new staff, they may need equipment, they're going to need computers, they may need laptops, they may need iPads or whatever it may be, or other sorts of things that they may need to have in order to effectively engage in those community-based services. Remote outreach, so that can look like such things as Zoom licenses or other ways that you are conducting outreach to community members. Staff training, which can also include training for supervisors, and then consumer facing education and outreach that is being conducted by the staff. So we recognize that many of your organizations are responsible for developing a variety of different education and information and outreach tools, and you can certainly use these dollars to support those efforts. So with that, I'm going to pause for just a moment to check in with Tavish to see if we have any questions that have come into the chat box before I continue on.
Absolutely. We did get one question about kind of the focus population. Yeah, but I know that that's coming up, I think, on the next slide.
Fantastic. That was perfect. Okay, then I will go ahead and move to that next slide, and then I'll take a second pause for questions in 3 more slides. Priority populations. So these are the priority populations that we have identified for this particular investment pool. These priority populations were developed in partnership with our Associate Director of Data and Analytics, Alexis DeRogers. She was able to take a look at a variety of dashboards and other tools to help us better understand which populations, again, right now are experiencing some of the greatest health disparities, again, based on a variety of different data sources. Based on Alexis's review, We've identified the following populations as priority for this particular funding, and that would be African American and Black community members, elderly. And when we say elderly, we define that according to the communities that you're serving. So we know that some communities, the age for someone who is an elder is different than other communities. So it's relevant to the communities that you're serving. Individuals who are homeless or unstably housed, individuals who are Indigenous or Native American, Latinx community members, Asian Pacific Islander community members, refugee and immigrant community members, as well as populations for whom English is not their primary language, other geographic areas experiencing significant health disparities. Most of the data right now is showing us that there is a particular focus in South King County specifically. And we also have created room for other populations who may not necessarily be reflected in the populations that we listed because we recognize that data dashboards are quantitative. Data dashboards are not always reflective of the kinds of things that you are seeing by way of the community members that you serve and you know are experiencing health disparities. So we are certainly open to different populations. We just ask within your application that you describe that population to us if it's a population that is not listed above and help us better understand the kinds of health disparities that that community is seeing based on your experience. We will be issuing payments according to this investment in three equal payments. The first payment will be 50%, I believe it is, upon, or I don't believe, never mind, don't quote me on that. Our chief financial officer is not here, so don't quote me on that. Instead, just rely on the contract document. We'll be issuing the first payment upon signing the contract, and that will be in July. The second payment will be at the midpoint. We will be asking you to submit a progress report to us. That will likely be around April 2022. The progress report will be submitted through our forms assembly process, and we will provide you with a template and information early on so that you'll know what kind of information we'll be looking to have you include in that progress report. And then that third payment will be upon the end of the award period and after submitting the final report, which will likely be January 2023. All of the funding for these dollars must be expended by December 31 of 2022. And if you do not expend those funds by that date, Healthier Here will have to receive those dollars back from you. So in summary, again, this is a 17-month award period with three equal payments, the first of which going out in July to help you get started, the second at the midpoint, and then the third at the conclusion of the contract period. Then finally, before I take additional questions, wanted to share with you what we'll be looking to gather by way of reporting and activity requirements. We will be asking you to submit two reports, one during the midpoint, the second at the final report. The report due dates and, in fact, the information will be detailed in the contract. We are looking to gather information, as you know, with Healthier Here. We focus on both quantitative and qualitative information, and we're really looking at gathering information to help better tell the story of what you are seeing in community, the kinds of services and supports you are providing in response to those needs, the kinds of strengths there are in community, and most importantly, how we know that it's working. We gather this information not just to provide the information to the healthcare authority, which we do as part of our semi-annual reporting as an ACH, but we also gather this information to be able to have a better understanding of what's happening overall in the healthcare system and in the social service support system throughout King County. The reporting requirements will include quantitative measures. So we're anticipating that we'll be asking about those types of things, such as how many people you're serving, the types of encounters you're experiencing, the number of people who are being screened for SDOH needs, helping us to better understand what some of those priority SDOH needs were during this contract period. the number of referrals that you're making, and the top 5 referral types. That's helping us to also better understand what we can do as a system to be more responsive to providing that whole person integrated care. We'll also ask for qualitative information, and that's better understanding what kinds of screening service and referral tools you're using, what kinds of best practices you have developed and or are relying on, and what kinds of lessons you have learned throughout this process. In addition to receiving the 2 narrative reports, we are also considering standing up a learning collaborative that will help individual organizations who are funded through this investment to create a space where they can connect with one another, leverage their lessons learned, help problem solve any barriers that they're seeing, and or identify any trends or system level areas of concern that Healthier Here may be positioned to help with. That will look for us like a learning collaborative. It's a learning collaborative that we are standing up because we received information through engaging with community and clinical practice partners in the fall of last year. And one of the things that we learned throughout that engagement was that our partners wanted to have opportunities to connect with one another and to have their staff connect with one another around common workflows and common focus populations as well. So this is one of those components that we are likely to include. We emphasize the word may because we also recognize that there are a number of other competing requirements that you have. So we are still forming what that could look like because we want to make sure that it's certainly not a burden for you, but rather that it is a value add for you. So with that, I am going to pause for questions and I am going to stop sharing my screen. And then after we take questions, Tavish will walk us through the application process. So Tavish, I will lean into you for questions that may have come in to the chat box, and then we will also invite people to unmute themselves if they'd like to ask questions.
So I got a question. This is AJ McClure from Global to Local.
Hi, AJ.
Hi, everyone. Thanks for doing this. This has been super helpful. So I have a question, and I might have missed it in the beginning or in some part during your presentation. But so on the reporting side, on the qualitative measures. So for some organizations that, I mean, clearly, I think we're all partners of HealthierHere, so we are receiving some funding already through HealthierHere. But like specifically for like the Catalyst Fund, right? So we have certain qualitative measures or quantitative measures that we are tracking per people we've helped through referrals, those kinds of things. Are we going to be required to separate those out for like this grant? So for instance, like, do we have to report separately, basically, on people that we're serving?
That's a great question. Thank you for that, AJ. One of the things that we learned very early on in our engagement with our partners is that we recognize that you have a number of different reporting systems and streams and requirement because of the funding that you receive. So the answer to your question is really going to be an it depends. And here's what the it depends is. So on the back end at Healthier Here, we do not want to add additional requirements on you. So we're going to look to see where we can align the existing reporting requirements that you have internally. And the it depends part is if there is a gap in some of the existing reporting requirements, then we may add something to that. But our goal first and foremost is to align what we're currently doing. An example of that can look like the screening and referral portion of the community partners existing contract for our system transformation contracts. And we added that and embedded that as a component in this work. And if you look at that reporting requirement, it looks very similar to what I just described by way of reporting requirement. So it will actually be the same. it won't be double dipping, but what we anticipate we will probably see will be that you'll have higher numbers is what we anticipate. So the short answer to that long answer is that we don't just want to stand up reporting requirements for you to have to track things that you may already be tracking for us, but we want to also take a look at everything before we make a definitive answer.
Great, thank you.
You're welcome. Thank you for that question. Also, I did just see pop up in the chat box that we had a request for slides, and we will be making the slides as well as the recording of this meeting available to you following this meeting.
Okay, Mario, we had a couple other things come up in the chat that I just want to highlight in case folks aren't watching that. It's moving pretty quickly.
Please.
Yeah, so we had a question about the staff that would be required to participate in the learning collaboratives, whether it would be all staff, all CHWs, or just the staff funded by this award. So I responded that the only staff that would be required to attend would be the staff covered by this award.
That's great. That's a great question too. Yes, it's great.
And then another question was, do we foresee this funding opportunity being available again in the future? And in the chat, I had responded that this is likely, a one-time award.
Yes.
Okay, and then we've got another question that came in that I have not been able to respond to yet from Stacy. Could this funding support advertising and outreach to fill peer support specialist positions? They have some positions filled and some unfilled. Filling all positions has been difficult during COVID-19.
That's a great question. That's a great question. I am going to, and Stacy, which organization are you with?
I'm with Valley Cities Behavioral Healthcare. So we have a number of peer support specialists, and it's been difficult filling any of our clinical positions or any positions at all, but in particular the peer support specialist.
Mm-hmm. Yeah, that's a great question. That is something that we have heard as well. So I had a hunch that it was with the behavioral health agency. So thank you for confirming that for me. Let's follow up. So we will follow up when we send out the materials, the follow-up materials today, because I will get myself in trouble by engaging in thought partnership out loud and want to connect with Michael McKee, our Director of Clinical Practice Transformation as well. I know that initially when we scoped this fund, we were thinking about the direct provision of services and really funding the direct provision of services. And in thinking about that question, I can also see where that may be difficult given if you can't get the people to provide the services. So we'll include that follow up. Tavish, if you wouldn't mind noting that for us, and I'll be sure to connect with Michael about that so that we can have some good thought partnership on that and give you a better answer and follow up.
I have another question if it's a good time. I'm wondering, could we also use some of this funding to pay for translation of our client handbook, or even a sort of more specific target audience client handbooks, and that perhaps there's misunderstandings and that's why we're disengaging with certain clients?
Absolutely. I apologize if I've got some background. It's always funny. We have these webinars during the time that landscaping folks come, but I think they know. They're like, she's on a webinar. So that's a great question. And you went where I was thinking, Stacy, which is translation services. Yes, absolutely. Translation of materials. Yes, absolutely. Especially if translation of those materials is going to help the community members that you serve better access services or engage with the healthcare system. So the answer to that is yes, with that caveat.
And Mario, we got another question in the chat box from Stephen at Chinese Information Service Center. Are we allowed to invite partners who are not currently eligible partners to submit a proposal jointly?
That's another great question. That's the fun thing about doing these webinars. So the answer to that question is yes, you're certainly welcome to. However, what you would do is your organization would need to be the lead entity, and you would need to list the different organization and then of course the scope of work, what all of that would look like. So in response to your question more directly, if you wanted to partner with someone to help, essentially they would be a subcontractor. So you can certainly do that, but the application would need to come first and foremost from your organization as a lead entity. Any other questions that come to mind before we talk you through the application process?
Okay, Mari, we've got one more in the chat from AJ at Global to Local. Could this fund training or consultant services for program strategic planning, evaluation, training? Yeah, and this might be best answered when we get to the budget, because there is a line for consultants.
You read my mind, Tavish. Yep, that's exactly where I was going to go. So absolutely. Great. So let's go ahead and walk through talk through or ride through the application process. And I think when we get to the budget portion, that may answer some additional questions that you may have. So with that, I'll turn it over to Tavish.
Okay, fantastic.
And Tavish, I'll watch the chat box for you while you're walking through that, if there are any questions that come in.
Okay, that would be wonderful. Yeah, so folks, just bear with me a moment. I'm going to share my screen and then I'm going to walk us through the application. Okay, so everybody should be able to see my screen and see a web page. So one thing you may have noticed as you were reviewing the RFA is we didn't include like a Word fillable application and budget as part of the RFA. We directed you to the form assembly link. Yeah, we're trying to kind of make things a little bit simpler on the back end for HealthierHere, collect all the information in one place, and we hope you'll find it easy to use as well. I know most of our community and clinical partners have used kind of the form assembly survey template in the past for various HealthierHere funds or reporting deliverables. Yeah, so up on the screen, I've clicked on the link to the application. You can see it up there at the top. And what I've done is I've already started filling out an application, to make it easy to kind of test what it looks like when you submit it at the end. Yeah, because you see these little red asterisks, we do require an answer to almost all of the questions. So for the application, up at the top, your organization name, a contact name for this funding opportunity, and that contact person's email address, so we can get in touch with any follow-up questions. And then question number 4, this is where you're going to say what type of partner you are. And Maria highlighted earlier kind of the 4 eligible groups of HealthierHere partners, the Tier 1 and Tier 2 community practice partners, as well as clinical practice partners who are classified as FQHCs or BHAs. And if you have any questions about your eligibility, feel free to reach out via email. And my email will be on the slides at the end. Then question number 5, you will see that these different focus populations track with the slide that showed the kind of the focus populations for this award. So you would just select all that apply, the different populations that your community health worker or peer investment is going to ultimately serve. Yeah, as an example, I chose elders, individuals who identify as Latinx, refugee and immigrant communities, as well as populations for whom English is not their primary language. And earlier, we did get a question from Global to Local about, like, for example, individuals with disabilities. So if you would like to serve a community that's not listed here, you'll select other populations here at the bottom, and then it's going to give you a box where you would describe who those populations are. So that's where you would put, for example, individuals with disabilities. Yes, similarly, question number 6, the geographic focus for this award. So you've got kind of the main geographic areas that HealthierHere serves, Central and South Seattle. You can see the list of neighborhoods in parentheses: North Seattle, North King County, South King County, East King County, then outside King County, and other. And if you select other, you would just kind of tell us a little bit more. And as an example, I just chose South King County. Number 7 is a new question that HealthierHere has been including to kind of align with our emphasis on equity and anti-racism. So we're interested in learning more about kind of who's leading your organization and whether it's reflective of the communities you serve. So this is our BIPOC-led question, which we define as organizations with 51% or more of board members and staff leadership identifying as being a member of the Black, Indigenous, and/or people of color communities. Yeah, so we just ask you to self-identify your organization as one of the following. Know whether you're Black-led, Indigenous-led, POC-led, BIPOC-led, yep, primarily white-led, or frontline staff is primarily BIPOC, but the organization is white-led. And again, we're kind of setting that marker at around 51% or more. And some of these groups can, interlock. So like, for example, I chose as an example, POC-led as well as BIPOC-led. Since people, may see themselves in both of those groups. Question number 8 is the start of our section on experience and goals. So this question asks if your organization has experience hiring or supervising any of these community-based non-licensed staff positions that are the focus of this award. So as an example, I chose community health workers and community navigators. And we also want to acknowledge that titles are just titles. You may have staff playing a similar role, but with a different title than community health worker or cultural navigator, for example. So if you have another type of position, like other community support specialist position, maybe you just call it something different, you would just check that box. And also, if you do not currently have experience hiring and supervising these types of positions, you would select none. And then we would likely follow up with some questions offline. Question number 9, this asks for a short narrative, including about this type of experience. So how many community health workers, peers, you're currently supervising. So you would tell us a little bit about your experience here in question number 9. And we ask you to keep it to no more than 500 words. Question number 10 is especially important. This is about kind of what your organization plans to do with these funds, kind of the main narrative of your application. So how would your organization utilize the Access and Engagement Fund to support communities experiencing health disparities, including ones that have been exacerbated by COVID? And in this response to question number 10, this is where we'd ask you to kind of ballpark, the anticipated number of people you anticipate serving through this award over the next 17 months, as well as any referrals made and tracked. And again, please try to keep that to no more than 500 words. Question number 11, how will this funding augment but not supplant the access and engagement services that your organization currently provides? So if your organization is currently already doing this work, you have other grants, other funding streams, you would just describe that here. Question number 12 asks for a little bit more information on how your organization approaches supervising and supporting community-based non-licensed staff. We've heard in our various conversations with community health workers, peers, that sometimes they don't feel like they're well supervised, especially at an organization that's kind of bringing in these roles for the first time. So we'd love to learn a little bit more about how your organization approaches the supervision of these community-based non-licensed staff positions. Question number 13 is similar. It asks you to describe your training and onboarding process for community-based non-licensed staff. So you would just describe how your organization handles training and onboarding of community health workers, peers, cultural navigators, et cetera. Question 14 asks how your organization currently funds these types of positions, kind of outside of this award from HealthierHere. Maybe you have other grants, maybe it's part of your per member per month rates, and you're able to carve off a little bit to support these types of positions. You would just tell us more about that here in question number 14. Question number 15 is about documentation. So how do your community-based non-licensed staff document their work? This is where you would talk about, whether they have access to an EHR system and they're entering notes, Do you use a community information exchange, CIE system like Unite Us, or a different kind of record keeping system? You don't have to be using something fancy, even if your staff are using like Excel spreadsheets, some other kind of means, Google Docs to communicate with each other. You would just tell us about that there. 16, ask specifically if staff at your organization utilize the Unite Us CIE system. This is a newer community information exchange that HealthierHere has been supporting the spread of in King County in the last year or so. And for that, if you're unsure, just check unsure. These next couple questions are about sustainability and partnerships. Question 17, how does your organization work to ensure sustainability of community-based non-licensed staff positions? We're all aware that many of these positions are kind of funded grant to grant, and that means the scope is changing a little bit every time you're on a new grant with a new funder. But there have been some efforts to ensure sustainability, so that it's not this constant stop and start and changing of scope. So we'd love to hear a little bit more about how you're working towards sustainability. Question 18, also about sustainability. Beyond the 17 months of funding, how would your organization work to sustain the staff positions you add if you receive this funding? Would you be exploring partnerships with the other organizations? Would you be in conversation with MCOs, sharing the great data, the cost savings that may happen because of your ability to ramp up these positions to serve vulnerable community members? So that would be sustaining it beyond 2022. And this says November, but that should be December 31st. My apologies. We were changing dates a little bit on the back end, but I'll fix that before you get into these applications. Question 19 asks, does your organization currently partner with clinical providers such as physical, behavioral, or tribal healthcare partners? So this organization is more for our CBO partners on the line. And you would just ask yes, no, NA. And if you have selected yes to question number 19, you get this follow-up question right here. If yes, are your community health workers, peers, cultural navigators, community navigators, and or recovery coaches incorporated as part of the care team that works directly with clinical providers? So we're interested in knowing, are these non-licensed community-based staff positions really incorporated into the care team and working with your partners, or are they kind of siloed? Because we see these positions as part of kind of a comprehensive integrated team-based approach. So we just like to kind of learn more about the current landscape and whether that's happening already, or if that's something HealthierHere can help support and make happen in the future. And then if your answer to that is yes, they are part of the care team, you get this follow-up question, if yes, how are you addressing care team roles and responsibilities? Kind of, who does what? How are people made aware of each other's roles on the care team? You would just provide a little bit of a short narrative there. And we are almost done. So question number 20 is the budget form. As I said at the beginning, we didn't include a fillable budget template as part of the RFA. What we've decided to do is kind of link it right here. So if you click on budget template, you'll see you can open the budget in Word. And it'll be like that. So you would just enable editing, save it somewhere on your hard drive or your shared drive to fill out later. And I do have an example budget template to go over right now. And then as the last thing, we'll show you how to upload it and attach it to your application. So here is the budget template. It's pretty straightforward. We ask that you use this sheet to provide a budget for the anticipated costs of implementing your organization's proposed scope of work with these funds. All budgeted amounts should include a brief description of the composition of the individual costs. And don't forget, the maximum amount you can apply for is up to $150,000. So I'll walk you through the line items right here, and the stuff I've added, just as an example, is in red. So up top, we've got salaries and benefits. And for a description, we ask that you talk about kind of position titles as well as allocated FTE. So as an example, for salaries and benefits, I put in, 2 community health workers, estimated at $60,000 salary plus benefits per FTE for a total of $120,000 for that line item. The next line item is about consultants, contractors. So this is where you would talk about, yeah, AJ, as you would ask, if you're going to use these funds to work with a consultant to maybe develop your program, work on sustainability, yeah, this is where you would account for those costs in the consultant contractor line item. Yeah, so that is an allowable expense as long as it ties directly to the work you're going to do with this award. The next line item is equipment and supplies. Yeah, things that your new staff are going to need: computers, laptops, phones, etc. As an example, small equipment purchases, office supplies. And I've put in red, laptops and computer accessories for the 2 community health workers. I estimated it at $5,000. And you don't need to kind of go into the specifics like each computer, each mouse pad. Yeah, you can kind of roll it up and just describe, what this money's going for in general. Yeah, like how I did here, laptops and computer accessories. That's perfectly fine. We know as we're emerging from COVID that we're going to be back to kind of the more face-to-face kind of in-home interactions that are kind of at the core of what many of these non-licensed community-based positions do. Yeah, so we did include a line item for travel costs. If you have a sense of how many miles your new staff are going to be putting it on their cars to do their work, you could kind of roll that up and include it here in this line item. The next line item is for other direct costs. And as an example, I put the in-language outreach materials, and this could include, the translation of those materials. We had a question about that earlier. I would put that in other direct costs. I think that's the best place to put that on this budget. And so I've done that as in-language outreach materials and estimated the cost at $10,000. The last line item is for indirect costs. If you tend to include an indirect in your grant applications, you would put it here. Yeah, generally HealthierHere caps this at around 15%. But if you have any questions, you can reach out to me and I will navigate that with our CFO. And you would just tell us kind of what your indirect rate is and then what that total is. And based on what I put in here in red, yeah, the total cost of this example budget are $135,000. Yeah, so to my eye, this is kind of hitting the mark of what HealthierHere would be looking for in a budget. Yeah, I'd make sure to save it. And then how do I get it back to HealthierHere? Yeah, so I would go back to the form assembly, go to question number 20, you click choose file. Oop, yeah, apologies for the pictures of my dog. Yeah, just scroll to wherever you had saved that budget template. I've saved it right there, and there you go. It puts it right in. Yeah, before I hit submit, I'm going to show you something else. So a cool feature of form assembly is that you're able to save your work and resume later. You just go back to the top, you check this box, and you would enter your email and a password. And then with that information, you're able to go back and resume a previously saved form. Yeah, but since I've got an answer in all of these boxes, I'm going to go ahead and click submit. Okay. And when you submit it, the first thing it does is it shows you what all your answers are. Yeah, they are here in bold. So you can check over your answers, make sure everything is correct. If things are not correct, you would go back by clicking make a correction. But if everything looks good, you confirm. And hopefully that's going through. That's unfortunate. I seem to be having some kind of issue with my internet. But we will check into this and make sure there's not a larger issue in form assembly. Once you've submitted all your information, you should be able to click confirm. You should get that confirmation. Okay. Yeah, technology is always a learning process, so we will look into this issue and include any information about anything that may change when you're working with the application, when we send the email with the link for today's webinar, the link to the video and the slides. So apologies for that. But now I'm going to go back to the slide deck and see if we have any questions.
Thanks so much, Tavish. A couple of questions came in. So for folks who weren't following the chat box, which is completely fine, you already touched on a couple of the questions, one of which was around admin costs. And as you indicated, we technically, we sort of keep them around that 15%. However, we are open to negotiation. We want to ensure that we are funding what is reasonable. And we recognize that for some organizations, that can be more, or for some organizations that can be less. So general rule of thumb is please do reach out to Tavish if you have questions about your admin costs before you submit your budget. Also, if you have included admin costs in other funding through Healthier Here and Healthier Here has not flagged that yet, then what you have included is fine. There was also a question about information about demographic and geographic information for priority populations. So we indicated on, I think it was slide 7, it may have been slide 6, we have taken a look at priority populations through a variety of dashboards, and we've highlighted a few of them. However, we are open to, again, looking at other information that you may have. So we are open to including other populations. I think a great example was raised around community members with disabilities. That information is not captured in many of these dashboards. So if you have information about community members experiencing with disabilities, experiencing greater health disparities, please do describe that population in your application as well as the geography to which they are attached. In short, we are not saying that we are only funding geographic areas such as South King, where again, we know that there some of those health disparities are highest. We're not saying that we're only funding South King. We recognize that health disparities happen in other areas as well. And we are looking to you as the experts of working with community members to tell us where that may be. That said, we did want to provide some guidance. So that's why we included the listing of priority populations. Similarly, there was a question around the translation and translating materials. If they needed to be translated only for those languages that are specifically referenced in the priority populations that we included on the slide deck, the answer to that is no. However, we will be looking to you to tell us why a particular population may need to have the languages translated. So if you know of a particular population that's experiencing health disparities and difficulty accessing or engaging with the healthcare system, and translating your handbooks into those particular languages would help to decrease those disparities, then we are certainly open to reviewing those applications. We also had a question that just came in that I did not respond to, and that is, can the funds primarily support patient care costs in a location that is preferable for folks who are reluctant to access care at other venues rather than outreach staff? Jack, would you mind unmuting yourself to maybe give us a little more context for that question so that we can give you a bit more of a more direct answer?
Yeah, thanks for the opportunity. I'm at HealthPoint, and there is a population of BIPOC LGBTQ people that we have relationship with, and they have deep community connections, but want to receive care basically in a place that is designed for BIPOC LGBTQ people.
Mm-hmm. Yeah, and so the question is, can you provide the care there? Can you do the outreach there? As opposed, oh, go ahead, I'm sorry.
Right, I'm sorry. You were tracking, yeah, like could we use this money to support the sort of startup for this vision and instead of outreach workers?
Oh, that's okay. That's a different question. Oh, that's a different question. Let's talk about that because that's a more specific question. So let's talk about that offline. Because, and what makes that a different question is when you're talking about supporting the startup of the provision of care versus providing the care. That could be the potential difference. So the answer to the first part of your question, can these dollars support providing services where people prefer to receive the services in ways that they prefer to receive them? The answer to that question is yes. So meeting people where they are, yes, you can use these dollars to meet people where they are. But starting something up that may not necessarily be related to providing the services, that could be more questionable, and we'd want to have more conversation with you. I would really encourage you to reach. Oh, Tavish is gonna speak to that as well.
Yeah, another piece of this. So the funds, in terms of funding staff, this is only intended to be for kind of the non-licensed community-based staff, like community health workers, peer support specialists, et cetera. Yeah, Jack, if you're thinking of kind of using it for like a nurse practitioner or a physician's assistant, that would not be an eligible use of funds. Yeah, we really want these funds going to the non-licensed community-based staff positions, since those tend to not have kind of sustainable funding mechanisms, yeah, other than grants.
Thank you for asking the question, and thanks for unmuting, Jack. That was great. That was good context. Wonderful. Well, thank you so much for your comment, AJ. We appreciate that, and we see that we are reaching time and approaching time. So we do appreciate each of you for being here, and we hope that you have found this to be helpful. If you do have additional questions, please, please, please do not hesitate to reach out to Tavish to talk through before you submit your application. Just as a reminder, please do be sure to submit your application and your budget by 11:59 on June 23rd. We are planning to announce the awards no later than July 16th. And again, if you have questions and if you are a clinical partner, please reach out to Tavish. If you are a community practice partner, please feel free to reach out directly to Mayani, and both of their contact information is included in the slide deck. And we will be sending a copy of this recording and the slide deck out to you as a follow-up to this meeting, as well as getting some additional thought partnership from Michael around the ability to use these dollars to help for the recruitment and retention of staff. Thank you very much to all of you for being here, and thank you for all of the work that you're doing. It is truly a pleasure for HealthierHere to be invited to partner alongside you in the important services that you are providing. Thank you for being here. And as always, please do not hesitate to reach out if you have any questions. Be well, everyone.
Thank you, everybody. Bye-bye.
Bye.